Thank you very much for the invitation. So I'm Stephanie Guey and I work with Dominique Hervé, the next speaker, at the CERFCO Center, which is the referral French Center for Rare Cerebrovascular Diseases in France and in Paris. And I will present you the data from a cohort of COL4A1-A2 patients that were recruited in France. And it was a cohort of adult and pediatric patients. These data have been generated through a clinical research program, an academic research program that was conducted in France between 2010 and 2014 and was promoted by Hôpitaux Publics. Public Hospital of Paris. And the aim of this research program was first to determine the implication of COL4A1-A2 mutation in intracranial hemorrhage, and secondly, to refine the COL4A1-A2 clinical spectrum. And patients were recruited from different expert center. For adults, there was 8 centers, including Lariboisière Hospital. And for children, there was 8 expert centers across France. This is an overview of the criteria inclusions. For adults, these criteria were, first, a brain hemorrhage before 65 years old of age without cause, essentially without high blood pressure. In addition to a vascular leukoencephalopathy, or in addition with a sign suggestive of collagenopathy, that is tortuous retinal arteries, malformation of the anterior segment of the eye, juvenile cataract, infantile hemiparesis, or intracranial aneurysm. They may be included also if they had no brain hemorrhage but a leukoencephalopathy, in addition to those suggestive signs, and if they had prior identified COL4A1, COL4A2 mutations. Children were recruited if they had a perinatal or post-perinatal brain hemorrhage without cause, or a parencephaly without cause, or a prior COL4A1-A2 identified mutation. And 41 adults and 17 pediatric patients were included in the whole research program. All these patients were sequenced for the 2 genes, COL4A1 and COL4A2, and at the end we had 17 adult COL4A1-A2 patients and 8 children patients that were included in the program. Of note, for the adults that were recruited on the criteria early onset and unexplained brain hemorrhage, 30% of them were mutated in COL4A1 or COL4A2. In addition to this recruitment, family investigations were conducted among the probants, and that allowed to include in the program 6 additional relatives, asymptomatic or symptomatic, but that carried the mutation. And at the end, we had 31 individuals, 23 adults and 8 children that carried the pathogenic variants that were included in this research program. Okay, just one word about the mutation spectrum in the cohort. Most of the patients were mutated in COL4A1 genes, that is 20 probants and 5 relatives, and most of them had a glycine mutation. 4 of them had a premature stop codon, and 2 were mutated in the NC1 domain. 5 probants and 1 relative carried a mutation in COL4A2 gene that was a glycine mutation in all cases. Now, what about the neurological manifestations in the adults in our cohort? Well, 30% of the 31 adults included already had experienced an intracranial bleeding with symptoms at the inclusion, considering that the median age at inclusion for our adult patient was 42 years old. And the age at first ICH ranged from 29 to 60 years old, with a median age of 42 years old. For 2 patients, it was a recurrent brain hemorrhage, and in 1 patient that you can see here, sorry, it was a synchron multifocal deep brain hemorrhage. In all patients, the hemorrhage involved deep region of the brain hemispheres or a brainstem in 1 patient. And in 19% of hemorrhage, there was an intense physical effort that preceded the occurrence of the hemorrhage. Also, 4 patients had ischemic stroke. Like you can see here in the deep region of the left hemispheres, and the median age at the first ischemic stroke was 33 years old. 1 patient had, sorry, it's okay. 1 patient and 2 ischemic strokes episode. About 2/3 of patients complained from headache, mainly migraine without aura. None of adult patients was epileptic. And 3 of adult patients reported history of infantile hemiparesis or porencephaly. Among the 22 patients that had a brain MRI, only 2 brain MRI were normal in patients aged of 31 and 39 years old. 15 patients had a leukoencephalopathy, 6 had macrohemorrhagic sequels, and 5 had microbleeds. And on the 19 patients that had magnetic resonance angiography, 6 had an aneurysm that involved intracranial circulation. We will see that. And that is an overview that the kind of the leukoencephalopathy that you can observe in adult patients. It's a leukoencephalopathy that vary in severity and that typically involved deep periventricular regions, but also subcortical white matter with a peculiar pattern that is an involvement of the very upper part of the brain hemispheres with this leukopathie that spare the U-shaped fibers in these regions. Microbleeds, not very. Microbleeds typically involve the deep brain regions and sometimes maybe more diffuse. You can see here. Deep brain, macrohemorrhagic sequels generally involve the deep brain regions, and you can see here the typical kind of aneurysms that are observed in such patients that involves the carotid siphons or that are fusiform aneurysms of the proximal part of intracranial arteries. Okay, and some adult patients had a parencephalic cavity that may vary in size with a very large parencephalic cavity with in adults that reported history of infantile hemiparesis, but also very, very small cysts in other patients, and this kind of little subtle anomaly might constitute for the physician a clue to suspect collagenopathy diagnosis. And now, what about the children in our cohort? I remind you that 8 children were included in this program research, and their median age at inclusion was 6 years old. And among these 8 children, one had a very dramatic history of symptomatic postnatal ICH, revealed by an epilepsy that occurred at day 3 of life. And that hemorrhage turned into a large parencephalic cyst on the control MRI performed several months later. 6 out of the 8 children had an infantile hemiparesis, 3 had a psychomotor delay, and 2 were epileptic. All the 8 children had an MRI, and 7 out of them had a parencephaly that was, here again, very variable in size, from the very large parencephalic cavity associated with a schizencephaly to a very subtle, more subtle ventricular asymmetry, like you can observe in this child, where the anomaly was incidentally discovered on a CT scan performed after head trauma. 5 out of the 8 had a leukoencephalopathy. And you can see that this leukoencephalopathy might be very subtle, like in this child, and sometimes extensive, involving deep gray nuclei and also diffuse white matter of hemispheres. 2 had microbleeds, 2 had gyration anomalies. And among the 4 children that had a CT scan, 3 had brain calcification. 4 out of the 8 children had a magnetic resonance angiography, and among them, none shown aneurysms. All the intracranial arteries were quite normal. Just one slide about the extraneurological manifestation that could be encountered in our cohort. In adults, 2 reported history of early onset retinal hemorrhage, and 3 out of the adults had a history of infantile cataract diagnosed between 9 and 13 years old. 2 patients had an early onset glaucoma, and other anomalies that were reported at inclusion were iris malformation and strabismus. 22, all but 1 adult had ophthalmological examination, and this exam showed cataract in 5 out of them, a microcornea that was quite frequent also, but also sometimes subtle optic disc anomalies that blurred disc or disc atrophy, and tortuous retinal arteries, that is an inconstant but quite specific sign of collagenopathy, was observed in only 3 out of the 23 patients. Children didn't have any systematic ophthalmological exam, but history of very early onset retinal hemorrhage was reported in 1 at day 6 of life. An infantile cataract was reported in another child, iris cyst in another, and an history of strabismus or amblyopia was reported in half of children patients. One word about renal manifestation. Renal cysts, hematuria, proteinuria were observed in a proportion of patients that varied between 10 and 20% of the patient of the cohort, and muscle cramp or increased muscle enzyme was observed in 2 out of the 23 patients. And in children, history of hematuria was reported in only 1 patient. So these data that are in accordance that all the previous presentation that we have just seen today help us to refine the spectrum of this rare disease. But didn't allow to perform genotype-phenotype studies because of the quite limited number of included patients. And now what's next? So far, in La Riboisière, including the patient of this program, we follow more than 50 adult patients mutated in COL4A1 or COL4A2 gene, and currently we are properly collecting all the database, all the baseline data to improve again our knowledge of the clinical spectrum of this patient. And the second step, it's not important, the second step is to collect natural history data that are very, very missing in this pathology because we have baseline data and we do not know what happened during the following years. And so we plan to call this patient because there are a lot of patients that were lost of follow-up. And we would like to know since the last visit what happened, what were the clinical events. It would be a first step, a simple step, but a first step to improve the knowledge about history of the disease. And the final goal is to set up a prospective, standardized follow-up for all these patients with the ultimate goal to pool this data with collaborators to again increase our knowledge of this rare condition. Thank you very much.